Welcome to our channel. Fatty liver disease, a condition characterized by the accumulation of excess fat in liver cells, has emerged as a significant health concern worldwide, particularly in the context of rising obesity and diabetes rates. This condition, often asymptomatic in its early stages, has become increasingly prevalent, affecting millions globally. The World Health Organization has identified non-alcoholic fatty liver disease as a major public health issue, with its incidence rising in tandem with the obesity epidemic. As obesity rates soar, so too does the prevalence of diabetes, creating a concerning link between these conditions and fatty liver disease. The implications of this epidemic are profound, as fatty liver disease can lead to more severe liver complications, including cirrhosis and liver cancer, ultimately impacting overall health and increasing healthcare costs. Recognizing the early signs of liver dysfunction is crucial for effective intervention. Symptoms may be subtle or overlooked, making awareness essential. Fatigue, unexplained weight loss, and abdominal discomfort can be indicators of liver issues, yet many individuals remain unaware of their significance. Early detection can facilitate timely management, potentially reversing liver damage and preventing progression to more severe conditions. As we delve into the topic, it is vital to emphasize the importance of proactive health measures. Prevention and management strategies play a critical role in addressing fatty liver disease, particularly in populations at risk due to obesity and diabetes. Lifestyle modifications, including dietary changes and increased physical activity, are foundational in combating this condition. Additionally, regular health screenings can help identify at-risk individuals, allowing for early intervention. Education on the risks associated with fatty liver disease, coupled with community support initiatives, can empower individuals to take charge of their health. As we explore the multifaceted aspects of fatty liver disease, it becomes clear that a comprehensive approach is necessary to mitigate its impact. By understanding the connections between fatty liver disease, obesity, and diabetes, we can better equip ourselves to tackle this growing epidemic and promote healthier lifestyles for future generations. Non-alcoholic fatty liver disease is defined as the accumulation of fat in the liver of individuals who consume little to no alcohol, making it distinct from alcoholic liver disease. Historically, fatty liver disease was primarily associated with alcohol consumption. But over the past few decades, the understanding of liver health has evolved significantly. A recent classification of NAFLD encompasses a spectrum of liver conditions, ranging from simple steatosis, where fat is present without inflammation, to non-alcoholic steatohepatitis, which involves inflammation and can progress to fibrosis and cirrhosis. This shift in classification reflects a growing recognition of the disease's complexity and its rising prevalence in non-drinkers. Statistics indicate that NAFLD is a global health concern, affecting approximately 25% of the world's population. This staggering figure highlights the widespread nature of the condition, with variations in prevalence across different regions. For instance, studies show that NAFLD affects around 30% of adults in North America and Europe, while rates can be even higher in certain populations, such as those with obesity or metabolic syndrome. The connection between NAFLD, obesity, and type 2 diabetes is particularly significant. As obesity rates have surged globally, so too has the incidence of NAFLD, with excess body weight being a major risk factor for the disease. The accumulation of visceral fat, which is often associated with obesity, contributes to insulin resistance, a key mechanism in the development of both type 2 diabetes and NAFLD. Research indicates that individuals with type 2 diabetes are at a higher risk of developing NAFLD, with estimates suggesting that up to 70% of diabetic patients may have some form of liver fat accumulation. This interrelationship underscores the importance of addressing obesity and metabolic health as part of a comprehensive strategy to combat NAFLD. As we continue to explore the implications of NAFLD, it is essential to recognize its historical context, current prevalence, and the critical links to obesity and diabetes, which together form a complex web of health challenges that require urgent attention and action. Identifying early indicators of liver stress and dysfunction is crucial for preventing significant health complications. Traditionally, liver disease has been associated with late-stage symptoms such as jaundice, severe abdominal pain, and swelling in the legs and abdomen. These signs often indicate advanced liver damage, making early detection challenging. However, recognizing early warning signs can lead to timely intervention and potentially reverse liver damage before it progresses. Subtle symptoms that may indicate liver stress include fatigue, unexplained weight loss, and mild abdominal discomfort. Other early indicators can be changes in appetite, nausea, and a general feeling of malaise. These symptoms are often overlooked or attributed to other causes, which can delay diagnosis and treatment. It is essential to understand that the liver is a resilient organ, capable of functioning even when damaged, which is why early signs can be easily dismissed. By being aware of these subtle symptoms, individuals can take proactive steps to address potential liver issues before they escalate. The importance of recognizing these early indicators cannot be overstated. Early intervention can significantly improve outcomes, allowing for lifestyle changes or medical treatments that can halt or even reverse liver damage. For instance, adopting a healthier diet, increasing physical activity, and managing weight can have a profound impact on liver health. Encouraging viewers to be proactive about their liver health is vital. Regular health checkups and screenings can help identify risk factors and monitor liver function. Individuals should not wait for severe symptoms to arise before seeking medical advice. Instead, they should prioritize their liver health by discussing any concerns with healthcare professionals. Additionally, educating oneself about liver health, including understanding the risks associated with obesity, diabetes, and excessive alcohol consumption, can empower individuals to make informed choices. By fostering a proactive approach to liver health, individuals can take control of their well-being and reduce the risk of developing serious liver conditions. In conclusion, recognizing early indicators of liver stress is essential for maintaining liver health and preventing significant damage. By being vigilant about subtle symptoms and prioritizing proactive health measures, individuals can safeguard their liver and overall health. Insulin resistance is a condition where the body's cells become less responsive to insulin, a hormone crucial for regulating blood sugar levels. When insulin resistance occurs, the pancreas compensates by producing more insulin, leading to elevated insulin levels in the bloodstream. This condition significantly impacts metabolic health as it disrupts the normal balance of glucose and fat metabolism, often resulting in various health issues, including type 2 diabetes and cardiovascular disease. The relationship between insulin resistance, obesity, and fatty liver disease is particularly concerning. Excess body fat, especially visceral fat, contributes to the development of insulin resistance. As fat accumulates in the abdominal area, it releases free fatty acids and inflammatory substances that interfere with insulin signaling. This disruption not only affects glucose metabolism but also promotes the accumulation of fat in the liver, leading to non-alcoholic fatty liver disease. Studies have shown that individuals with obesity are at a significantly higher risk of developing NAFLD, with estimates suggesting that up to 70% of those with obesity may have some degree of liver fat accumulation. The cycle continues as fatty liver disease can further exacerbate insulin resistance, creating a vicious cycle that complicates metabolic health. Highlighting the importance of monitoring insulin levels is crucial for early detection of insulin resistance and its associated risks. Regular blood tests can help identify elevated insulin levels, which may indicate the onset of insulin resistance before more severe metabolic issues arise. Additionally, monitoring other markers such as fasting blood glucose and lipid profiles can provide valuable insights into an individual's metabolic health. Early detection allows for timely interventions such as lifestyle modifications, including dietary changes and increased physical activity, which can improve insulin sensitivity and reduce liver fat accumulation. By being proactive about monitoring insulin levels and understanding the connection between insulin resistance, obesity, and fatty liver disease, individuals can take significant steps toward improving their overall health. In conclusion, insulin resistance plays a pivotal role in the development of fatty liver disease, and recognizing its impact on metabolic health is essential for prevention and management. Through awareness and early detection, individuals can mitigate the risks associated with insulin resistance and promote healthier liver function. Assessing the risk of fatty liver disease is essential for early detection and effective management. One of the emerging tools for this purpose is the Fatty Liver Index, a non-invasive scoring system designed to estimate the likelihood of fatty liver disease based on easily obtainable clinical parameters. The FLI incorporates several components, including body mass index, waist circumference, triglyceride levels, and gamma-glutamyl transferase levels. By analyzing these factors, the FLI provides a score that helps categorize individuals into low, moderate, or high risk for developing non-alcoholic fatty liver disease. This method is particularly valuable because it allows for quick assessments without the need for invasive procedures. However, while the FLI is a useful screening tool, it is important to acknowledge the limitations of traditional testing methods, such as liver biopsies. Biopsies, which involve taking a small sample of liver tissue for examination, have long been considered the gold standard for diagnosing liver diseases. However, they are invasive, carry risks of complications, and can be uncomfortable for patients. Additionally, biopsies may not always provide a comprehensive view of liver health, as they only assess a small portion of the liver at a single point in time. This has led to a growing interest in non-invasive alternatives like the FLI, which can be performed in a clinical setting without the associated risks of a biopsy. Encouraging viewers to utilize accessible tests to monitor their liver health is crucial. Regular checkups that include blood tests to measure liver enzymes, lipid profiles, and other relevant markers can provide valuable insights into liver function. Furthermore, lifestyle assessments that consider diet, physical activity, and weight can help individuals understand their risk factors for fatty liver disease. By taking advantage of these accessible testing methods, individuals can proactively manage their liver health and make informed decisions about lifestyle changes or medical interventions. In conclusion, assessing the risk of fatty liver disease through tools like the Fatty Liver Index offers a practical approach to early detection. By understanding the components of the FLI, recognizing the limitations of traditional testing methods, and utilizing accessible tests, individuals can take significant steps towards safeguarding their liver health and overall well-being. The impact of diet and lifestyle on liver health is profound, as the liver plays a crucial role in metabolizing nutrients and detoxifying harmful substances. A balanced diet that is free from processed foods is essential for maintaining optimal liver function. Processed foods often contain high levels of unhealthy fats, sugars, and additives that can contribute to inflammation and fat accumulation in the liver. These foods can lead to conditions such as non-alcoholic fatty liver disease, which is increasingly prevalent in today's society. By focusing on whole, nutrient-dense foods, individuals can support their liver health and overall well-being. The role of carbohydrates and sugars in the progression of liver disease cannot be overlooked. Diets high in refined carbohydrates and added sugars can lead to insulin resistance, a key factor in the development of fatty liver disease. Where the liver is overwhelmed by excess sugar, particularly fructose found in sugary beverages and processed snacks, it converts this sugar into fat, leading to fat accumulation in liver cells. This process not only contributes to an NAFLD, but can also exacerbate inflammation and liver damage over time. Therefore, it is crucial to limit the intake of sugary foods and beverages, opting instead for complex carbohydrates found in whole grains, fruits, and vegetables, which provide essential nutrients without the harmful effects associated with refined sugars. Encouraging viewers to adopt healthier eating habits is vital for reversing liver damage and promoting liver health. Simple changes, such as incorporating more fruits and vegetables into meals, choosing lean proteins, and opting for healthy fats like those found in avocados and nuts, can make a significant difference. Additionally, staying hydrated and reducing alcohol consumption are important steps in supporting liver function. Regular physical activity also plays a crucial role in maintaining a healthy weight and improving insulin sensitivity, further protecting the liver from damage. In conclusion, the impact of diet and lifestyle on liver health is significant, with a balanced diet free from processed foods being essential for preventing and managing liver disease. By understanding the role of carbohydrates and sugars in liver health and making conscious dietary choices, individuals can take proactive steps to reverse liver damage and enhance their overall health. Monitoring liver health and assessing insulin resistance through blood tests is crucial for early detection and intervention. Several key blood markers can provide valuable insights into liver function and overall metabolic health. Among the most important markers are alanine aminotransferase and aspartate aminotransferase, which are enzymes released into the bloodstream when the liver is damaged. Elevated levels of these enzymes can indicate liver inflammation or injury. Additionally, alkaline phosphatase and gamma-glutamyl transferase are other enzymes that can signal liver dysfunction or bile duct issues. Bilirubin levels, which measure the liver's ability to process waste products, are also essential. Elevated bilirubin can lead to jaundice and indicate liver problems. Another critical marker to monitor is albumin, a protein produced by the liver. Low levels of albumin can suggest impaired liver function, as the liver may not be producing enough of this vital protein. In assessing the risk of insulin resistance, two significant markers are hemoglobin A1c and triglyceride levels. A1c provides an average of blood sugar levels over the past 2 to 3 months, helping to identify individuals at risk for type 2 diabetes. Elevated A1c levels indicate poor blood sugar control, which is often associated with insulin resistance and can contribute to fatty liver disease. Triglycerides, a type of fat found in the blood, are another important marker. High triglyceride levels can signify metabolic syndrome and are closely linked to liver fat accumulation. Monitoring these markers can help individuals understand their risk for developing liver disease and related metabolic disorders. Encouraging regular blood tests is essential for catching potential issues early. Routine blood work can help identify abnormal levels of liver enzymes, A1c, and triglycerides, allowing for timely intervention. Early detection can lead to lifestyle changes such as dietary modifications and increased physical activity, which can significantly improve liver health and reduce the risk of developing serious conditions. By prioritizing regular blood tests and understanding the significance of these key markers, individuals can take proactive steps toward maintaining their liver health and overall well-being. In conclusion, monitoring blood markers is a vital aspect of assessing liver health and insulin resistance, enabling early detection and effective management of potential health issues. If you're feeling extra generous and want to support our channel, consider sending a super thanks by clicking on button right below this video or the 3 dots. It looks like a heart within a dollar sign. By clicking on it, you can choose to make a small contribution to our channel. Your contribution helps us to keep bringing you valuable content and fuels our passion for creating. We're grateful for your support and can't wait to see your super thanks messages. In summary, recognizing the early signs of fatty liver disease is crucial for preventing serious health complications and promoting overall well-being. As we discussed, subtle symptoms such as fatigue, unexplained weight loss, and mild abdominal discomfort can be indicators of liver stress that should not be overlooked. Early detection allows for timely intervention, which can significantly improve outcomes and even reverse liver damage. By understanding the connection between lifestyle factors such as diet and physical activity and liver health, individuals can take proactive steps to safeguard their liver function. Monitoring your health is essential, and regular checkups, including blood tests to assess liver enzymes, insulin levels, and other key markers, can provide valuable insights into your metabolic health. By staying informed about your body and recognizing the risk factors associated with fatty liver disease, you empower yourself to make informed decisions about your health. Simple lifestyle changes such as adopting a balanced diet free from processed foods, reducing sugar intake, and incorporating regular exercise can have a profound impact on liver health and overall quality of life. We encourage you to take these proactive steps seriously and prioritize your liver health. Engaging in regular health screenings and being aware of the signs of liver dysfunction can lead to early detection and better management of potential issues. Remember, your health is in your hands, and taking action now can prevent more significant problems down the road. If you found this information helpful, we invite you to subscribe to our channel for more health insights and also watch the latest video on our channel, 10 Warning Signs of Cancer You Should Not Ignore.